Hi, my name is Faisal Khan, and I'm senior counsel at Nixon Gwilt Law, specializing in hospitals and health systems and provider practices. And I'm really fortunate today to be joining with a friend named Pete O'Neill, who is an expert in hospitals and health systems innovation. And we're going to be able to talk on a few questions that are of real interest to hospitals and health systems, clients and potential clients. And then also in the topics, also answer them in a way that kind of addresses some of the outside external hospital and health system customer concerns on some regulatory issues. And so with that, I just want to briefly introduce you to Pete O'Neill.
Thanks, Faisal. It's great to be here. Thanks for including me. Brief background, aeronautical engineer by education. I think most relevant to this discussion, worked in Cleveland Clinic Innovations for almost 16 years, the final 4 years of that as the executive director of the activity. I also had a small stint where I left the Cleveland Clinic to be CEO of one of our spinoff companies. So I think I have a rare perspective of living significantly inside the hospital, but also living on the other side of the deal. So I really look forward to talking through some of the topics today.
Yeah, thanks, Pete. So one of the questions we get a lot at the firm, and me personally, is what do hospitals think about innovation? How do they think about it? How do they operationalize it? And how can some of these hospitals innovate their current operations and ability to contract with companies to get technology or create technology in-house?
Sure. As I work with groups around the country, I see the word innovation used a lot. I see it meaning lots of different things at different places. In some places, it means more like a tech transfer. Hey, how do we have our intellectual property move into products and we make money off of that? I think for some places it's a fuzzy idea of we want to be leaders in our region for the culture of innovation and just do and so talk about it a lot and foster and promote innovative things. And I think there's other places where it's more purposeful. There's obviously tremendous advancements in healthcare that are happening all the time, all around the country, all around the world. How does a hospital wisely bring the best of those, the most appropriate of those, into their own hospital system to improve their operations and improve patient care? So I think for any kind of engagement related to improving innovation for a hospital system, it's important to be clear about what the hospital's expectations are, what their goals are, and so there's good alignment. Maybe I could ask you, Faisal, how do you see outside legal counsel adding value to hospital innovation activity?
Yeah, thanks for that question. So the answer kind of aligns with what you were talking about. So as far as innovation taking shape in a number of ways, in my experience, being former in-house counsel, when I was in-house, I used to think about engagements almost from a risk mitigation standpoint. Obviously, value add as far as getting a new service or new technology or system in place. But my role is sort of to give the business folks and the innovation folks the information that they may not be aware of from a legal perspective or a compliance or risk perspective. And so with that lens, I absolutely think outside counsel can help inside counsel be a little bit more broad and more sophisticated in the legal counsel they're giving the inside innovation or other business leader clients, so that they're able to focus on the more routine in-house counsel things like compliance, risk management. But from the outside counsel perspective, right, that's being in the trenches with new technologies, new ways of delivering care, to help them think through that risk analysis so that they're focused on kind of the key in-house goals, but then also able to provide that additional value so that you can have a more broad guidance as to how you can reduce risk, but in the process, really push for new innovation that really improves the standard of care or operations so that things are more efficient. So thank you for that question. The next question that I get from clients and potential clients is how they can think through creating a innovative culture within the staff. Several clients and potential clients recently have talked about, you know, we're trying to figure out what innovation means for us. And we're also trying to figure out how to not only get innovation thought through from the system side, but then also work with the clinical and business leaders all the way down to the staff, non-physician staff, to develop that culture of innovation. So with that, how do you think hospitals and health systems can work to create that shift, that new culture?
Sure. I think there's lots of elements that go into culture. Ultimately, it's embodied in the people, and especially the leaders of the organization. And I've seen, as I said, working with groups around the country, lots of people who talk about wanting to be innovative. They don't really follow through on it on their actions, and I think that leaves a hollow, and there really is not that culture of innovation at those kinds of places. So it's embodied in the leaders. And what I've seen, and it sometimes can feel like a minor point, but I think having a clear IP policy is an important consideration there, because having a clear IP policy is really essential to building transparency and trust amongst the staff. And I just think those are traits that are necessary to build a culture of being innovative. I mean, if you think about being innovative, a culture of innovation, it's all of your staff, your frontline caregivers, your operations staff, having the creativity, the freedom of mind to be creative, and then also the trust to share those ideas and to not be teased, and on the other side, to actually feel like there will be some receptivity to those ideas. And I think having a clear, effective IP policy is an essential foundation for that. So maybe, again, if I could turn that question back to you, Faisal, how do you see in your work legal groups helping really implement those kinds of IP policies?
Yeah, I think it's huge. And I think that is almost one of the key things that the systems need to be thinking about from the get-go. Because without that key policy, right, you don't necessarily know, you don't have a common framework to guide innovation. You also have fragmented deals and fragmented arrangements. And then also on top of that, you also risk running afoul of existing contract requirements with other companies, perhaps other grant sources. And if you're an academic medical center or health system, right, you also have that huge issue to deal with and how to structure innovative discoveries in a way that doesn't run afoul of restrictions on IP ownership and proprietary information. So I think it's absolutely key. I also think it's key to have the legal counsel directly engaged with the creation of that policy and updating it, just to make sure that it works for the particular institution, but then also making sure that it doesn't run afoul of any legal requirements under existing contract obligations. So I absolutely think it's key. And I also think it's key to have legal counsel from the very beginning working on that policy and throughout the policy review and updating it as well. So
I agree. I mean, that's what I've seen as successful. So I agree with your comments completely.
Yep, great, thanks. And then the next question that we get a lot from providers and hospitals and health systems is how to work with finance and business leaders to think about new innovations in a way that promotes financial success or limits financial detriment. So my experience, I've seen a lot of ideas come out as far as changing an operation, adopting a new technology, investing in certain technology, creating new technology, or partnering with another company. But one of the key questions from the finance side is always, what is this going to cost me, or what's our, how is this going to increase the bottom line? So I wanted to hear from you how you have worked with providers and hospital leadership to answer that question in a way that allows the innovation to continue, or refinement of the innovation so that it not only hits innovation goals, but then also aligns with the hospital's finance policies and procedures.
Sure. So if you think about, I think a first part of that is getting comfortable with the idea that it's appropriate for hospitals to make money off of the innovation activity. I think, there's some people that would suggest, oh, you're a hospital, you're in this for patient care. And so many hospitals are not for profit, organized as not for profits, right. Which I actually think is part of the requirement that they receive fair market value for when they make, a contribution to something that's going to make money. From my experience, nothing. I have not ever found a product that is impactful in improving patient care that somebody doesn't make money from that. And if a hospital contributes to that product, especially I think it's their requirement to receive fair market value. So okay, so that's their is it okay for a hospital to make money? Yes. How likely is it that a hospital is going to get rich from their innovation activity? I think it's possible, and I think it's possible to happen quickly. I do think it's like so many things to think about it as a return on investment. And it's not just your direct cash investment, but I think it's also, to what extent is your organization invested in advancing these kinds of activities? And so I go back to, I think I made the comment around culture. If it's lip service, then I think that's an organization that's not invested in advancing things. And I think it would be unrealistic to think that kind of place is going to have large financial returns. However, if an organization is aligned with being committed to, and this will almost certainly come from the top down, but it has to be pervasive. It's aligned with supporting innovation activity, being good partners, because there's almost always going to be some other group that's going to help move a project forward. You're really a good partner in projects. I think that kind of investment, which can include a financial investment, can pay meaningful returns, returns that are impactful to the organization. So, so I think it's entirely possible and appropriate. So, again, forgive me. I'll put that question back onto you. What do you think about how to manage those kinds of returns and the risks that come from those, from the legal perspective?
Yeah, great question. So I think the words you said that ring in my ears is return on investment. And from a legal standpoint or an outside counsel perspective, it is looking at the particular arrangement or innovation activity and thinking about it in a way that reduces risk, but really saves money from the system's bottom line. So if we're thinking about reorganizing particular way of delivering care, if that's through innovating the way providers interact with a particular in a particular service line, if it is updating the procurement processes and due diligence that I think systems have had to deal with in the last year and a half with the COVID-19 pandemic. It's looking at those arrangements in a way to minimize risk, but also help get them done, because ultimately, if the project is successful, you are actually saving money to the hospitals. For example, you could take a look at any type of clinical care aspect where you've got significant claims risk or litigation risk. Working with quality institutes and providers to update processes, let's say that we've figured out during claims lessons learned subclaims process, to change that so that you've got far lower level of risk with that particular claim or that particular injury type. So that's one way I think about helping finance appreciate the value of additional outlay of costs at the beginning, but ultimately, right, it's going to return back to the hospital in the form of significant savings. Same with supply chain innovation. We've seen a lack of, existing processes not being able to keep up with changing demand, changing supplies. And so you've got to think about working with the ops folks and the supply chain folks and legal to kind of evaluate that risk from a different lens, so that you're able to have that analysis where you might be willing to accept a small level of additional risk in the contract, but that's obviously going to get balanced out tenfold in being able to provide better care, better continuity of care, and better access to care for patients. So that's kind of the way I think about how outside innovation counsel can help inside counsel think through more broadly how to better serve their inside hospital clients. So thank you for that. And then the last question I have deals with hospitals and health systems that already are involved with the innovation processes and have innovation departments or innovation staff, and that need a little bit of help figuring out, once they've got some baseline processes in place, how to scale that department in a way that serves the system and continues to serve and advance the system's priorities, but also is able to address, appreciate, and reduce some of the risks that come with increasing innovation activity. So curious to get your thoughts on how you've worked with providers and business leaders in the hospital system to kind of go through that thought process and provide good guidance on those areas.
Sure, thanks. We used to talk about risk management, not risk avoidance. I really think that risk is inherent in being innovative. I think anything that doesn't, if it doesn't include any risk, that's you're just sourcing something, right? And so, but to do something innovative, there's some risk with that, and so you can't avoid that. You can certainly manage that and mitigate it. I think Cleveland Clinic, my experience there was a relatively risk-adverse kind of place, but still highly innovative. And so it's of course possible, but I think with good planning and strategies to put in place, you can absolutely build an innovative culture amongst the staff that are individually prosperous and also support the organization. You can do activity that's brings financial benefit to the organization, and also managing risks at the same time. So those are not incongruent ideas. Those are possible. It certainly takes work. I worked significantly at the Cleveland Clinic with in-house counsel as part of the risk management strategies. I'd be interested to hear from you, Faisal, how you, as outside counsel, find your experience supporting and helping the inside counsel groups at hospitals.
Yeah, no, thanks. I look at it as risk management as well, and I think part of that risk management process as outside counsel is to have that knowledge, working with innovation discoveries, companies that are focused on new technologies, new ways of delivering care, maintaining care, enhancing care, the ways of the way patients prefer to receive care and delivering in those new avenues. I think some of the risk management counsel that we can augment inside counsel is that we've seen these companies work with hospitals and we've got the deals done. So we're able to share experience on data protection and security, patient engagement and patient outcomes, and be able to say, I absolutely hear all your concerns. These are the ways that some of these companies and technologies we can address these concerns, and really help educate the inside counsel team on what the arrangement will look like once the contract's done, and how to operationalize the arrangement so that inside counsel doesn't have to worry about, the contract's done, but now it's up to the business leader or the clinician to figure out how to work the deal, and operationalize it in a way that a potential legal problem doesn't come back to the law departments. So I just think having that real expertise and being in the innovation legal industry, so to speak, day in, day out, really helps inside counsel appreciate the risk analysis and steps to mitigate that risk as they're evaluating contracts and potential arrangements.
Yeah, I'll just add, I think you're exactly right. Your perspectives would be great there. So absolutely.
All right. Well, thank you, Pete. It's been a real pleasure talking to you today, and look forward to speaking with you again soon and talking about some other key topics and issues related to providers, hospitals, and health system innovation. So thank you.
Thank you, Faisal. As always, good to talk to you.
Same. Talk to you soon.
Thanks.
Bye-bye.